Welcome to the third session of our Family Medicine Application Series, interviewing from the Association of Black Family Medicine Physicians. I'm Dr. Ryan Walker. I'm okay if you just call me Ryan. And I am helping to lead this series. I first want to congratulate all of you on the accepted and waiting interviews. And I hope that some of this information that we talk about will help you all through that process. So, first, some tidbits about interviewing. First, I want you all to take a very deep breath in through the nose, out through the mouth, in through the nose for about a 4 count, and then out through the mouth with the 8 count. You guys are doing it. So, first, just try to recognize that, the program sees something in you that they are interested in and really want you and are considering you. So pat your backs for that. And the first thing is really the interviews is a conversation. So this is just an opportunity for them to get to know you better and to understand what your goals are and determine if you are a good fit for them, if they can really provide you what it is that you're looking for. And much of the conversation, honestly, will be based on what you've included in your application. Some programs may also, have identified questions that they ask everyone that varies by program to program. Other thing is just be yourself. They really just want to know who you are, as I mentioned before, and there's an opportunity to do that. So, first thing I think is really important is identify what your agenda is. So, kind of going into the interview, determining what you want the interviewers to know. They're already going to know some things from your personal statement and your application overall, but you really want to say, what do I want to leave the interviewers with? And for me, it helped to basically write down like what are my skills, what are my strengths, what is it that I'm looking for, and so that everything that I talk about during my interview kind of goes back to that, so that they really know who I am, what I'm looking for in a program, and they're left with the skills that I feel I have that can make me a good resident. And so, again, you want to really highlight your assets and why you would be a great resident. So, you're learning to come into your own as a physician in residency. And so, really understanding what your practice philosophy is, being able to articulate that to them. And also, what are the things that you're working on or that you would like to develop? And so, that helps them to kind of see themselves in your journey into becoming a good physician. So, I definitely recommend doing it the night before, or a few nights before, and then reviewing the night before. But before every interview, kind of reviewing what it is that you want the interviewers to know about you, and what your assets that you're bringing to the table, as well as kind of just writing a list of strengths and weaknesses. So it's a very common question that people will ask: what are your strengths and weaknesses? How do you overcome challenges? And that one question that someone asked was how to answer a question like that. And so it varies. I think for strengths, you can really talk about these are the skills that I have. This is how I've demonstrated those skills. And then speaking about challenges or things that you're working on and how you've learned how to um, work with those challenges, get around those challenges, or how you've been able to improve those challenges, or even make your weaknesses strengths as well. So I think it's really important that you have specific examples. So if you feel like you're someone that isn't organized, talking about how you may use a calendar or alarms, things like that, you really want to be strategic about highlighting your weaknesses and how you're problem solving to work on that, right? We all have strengths and weaknesses. And so I think it takes a lot of time to really think about what yours are and how you've been able to utilize those to your advantages, both strengths and weaknesses. The other thing I think is really important when you go in is really write down what your ideal practice would look like. Some places may ask you like, where do you see yourself in 5 or 10 years, or what is it that you're looking for in your future practice or something like that. So you want to have that in mind, but also have it in mind to say, is this going to be a place that's going to set me up to be able to practice in the way that I want to practice? And the last thing is really knowing the program. So you really want to do your research. I'm sure you did it before you applied. It may have been some time between the application and then also interviewing. So I definitely recommend going back to the websites of the programs, or going back to your list of why you applied to this program, so that you can also articulate that in your interview. When you talk about, my ideal practice is this, or this is what I'm looking for, and your program has this because, or I read about this, and if you could tell me more about this, this is something I'm very interested in. It might be something I would like to also include in my practice. So those are all things that are important before even getting to the interview. So I think it's really important that you're knowledgeable prior to interviewing for your family medicine residency, what the program offers, some of the people there, perhaps, some of the structural things, but your interview is also to get to know them as well. So you don't have to know everything, but it's really important that you kind of know the mission, the vision of the program, and what they have to offer. So other tips go to preparation as well. So, with us still being in the midst, or having a new normal with COVID, you have to have a setup. Most places are doing still virtual interviews, so your setup needs to be on point. So get fly in your attire. Make sure that where you're located is a very quiet space. There's good lighting. A lot of people are using the kind of photo lighting as well. Some are very cheap, like $14, so you can go on Amazon or wherever you shop and get one of those lights also to help with good lighting. It's also important that your background or wherever you are there is neutral, professional, but you can also have personality within that. So you can include unique paintings or items related to your interests. It may pique the interest of your interviewers if they see certain, whatever background behind you, and may ask you about it, or you could also bring it up yourself if you so desire to talk about that and bring part of your personality. Always be on time. Also, remember that each program is kind of different. So, some places the interviewers may be coming from clinic or from the hospital. Hopefully, not. But just know that they may not always be on time. It is really important that you're on time to your interviewee. So, now you have your setup, and we talked about a few pointers about some things to talk about for you to have your agenda going in. Other things that you should really be prepared for is having an answer for the quote unquote red flags. So this consists of if you failed steps, or there were some concerning comments in your rotations, or if you failed a rotation. You really want to have an answer for why it happened, what you learned from it, how you got past it, and just leave it at that. You don't need to go into explanations or excuses of this long drawn out story. Just say, I was struggling with this in this particular situation. I learned this about myself. I learned or gained these skills from that situation, and I've actually been able to utilize it and move on from that, or I was able to excel on repeating whatever it is, whatever your red flag is. Or if you took a substantial amount of time off during medical school or in between medical school and applying, you definitely want to have answers for that, because they will ask you that. Also have a question prepared for, do you have any other questions? Especially like if you're interviewing with residents or in the program director, you really want to have a question for that. They really are there to answer and make sure that you have a good idea of what their program offers, so that you can make a great an informed decision about the program. So have a question for that. I also want to say that it's okay to ask the same question of different people. And I say that to say that sometimes you may not get the answer that you were looking for the first time, and it's important to get a different perspective. And if you notice that the questions are kind of consistent and it's not really what you're looking for, that's an opportunity to say, oh, this might not be the program for me. And I experienced that when I was interviewing and I asked this question about community engagement, and the answer was very tailored to certain patient populations being served, and that's not what I meant. It was great that they were keeping that in mind, but community engagement was a very more tactile, actionable thing, and not just providing medical care to certain populations. So that helped me to understand that, oh, well, this program doesn't really understand what I mean by community engagement because I asked this one person, I asked it a second time in a different way, and I still got the same response. So that's also something to keep in mind, that it's also okay to ask the same questions of different people. But I think it's also important not to ask questions that you can easily find on a website. So ask very informative questions that you are going to learn new information for. Don't just ask a question to ask a question. The other thing is that you can look at the AFP residency interviewing questions to kind of get ideas of other questions to ask. So that's another resource that you can potentially use. I wouldn't say go and try to prepare answers to every question that you can find. Like I said, it really is a conversation and it should flow, and so you don't want to sound too rehearsed. So some other questions that we got were, should you leave your mic on to allow for natural back and forth conversations, or keep it muted so you're not talking over the other person? I would definitely leave your mic on so that you can have a fluid conversation. So that's a good question. Another question was, if you live next to the hospital and the noise from ambulances come and going can be clearly heard in your apartment, should you find a different place to interview, or will interviewers understand? I would find a different place to interview. You definitely don't want that to be a distractor from your interview. So if you have to go to the library or go to your school and find a study room to do your interview in, I would definitely do that, because you don't want that to be a distractor. And you want to have them be able to understand them clearly and they understand you clearly. Another question was, how do you stand out during virtual interviews? So I think really being able to articulate what it is that you're looking for in a program, knowing yourself, and being able to kind of review those questions that we talked about before. And then also, like as I mentioned, having your background be things that you might be interested in or related to, or say something unique about you, but in a professional way, and I think can help you to stand out as well. And then another question was, what are considered red flags program directors seeking interviews that could cause them to not consider an applicant? Like I said, if you're already interviewing, they're already interested. So they still may ask you about quote unquote red flags, but like as I mentioned, that might include failing the boards or not passing a particular rotation. But people aren't literally gonna be looking and say, oh, they passed this number of things, they got honors in this many things, they got high pass in this many rotations. Like, they don't have time to go that detailed. The things that they're going to be looking at is, what have people said about you? If there were any concerning things that people said, like you didn't work well in teams, or you didn't take feedback well, or something like that. But otherwise, like, it kind of is very generalized, because you have to keep in mind that different medical schools grade differently, and so they have to take all those things into consideration. So there's not a lot of weight on that at some places. Like I said, every program kind of has a different screening process of how they offer an interview to someone, how they score, and then decide to rank people. So that varies by the program. And unfortunately, a lot of programs are not very transparent about that. But if you got an interview, they want you. And so just have an answer to any concerns that they may have, or that might come up. So how do I answer behavioral questions? I think the other thing that's important is to remember that it's okay to take pauses. Okay, so if you have a question that you might need to think about, it's like, that's a good question. Let me think about that. And it's okay to take a second. And I think that's important because that shows that one, you're okay with asking for what you need. Two, that shows that you are thoughtful about your response. And I think that's it's great to do, and I'm very always impressed when people can do that because sometimes you do need questions. I remember having an ethical question and I had to do, I was like, ooh, that's a good question. Kind of stuck me in my tracks a little bit. I didn't say that, but I was like, oh, that's a good question. I was like, let me think about that. And, I took, a few seconds and then you move on with your answer. And so there are so many different type of behavioral questions, like situational ones, ethical ones, theoretical ones. So it's hard to say how to answer it. I would just say answer it truthfully about what you would do and have a reason for why you answer that, especially if they're open to hearing that. Because I can tell you, I had a theoretical and ethical question, and it was probably not what most people would have done, and it meant breaking the law. But my response of why that was I think very different, and it said a lot about kind of my values as someone who feels that I have to advocate and sometimes you have to sacrifice for change to happen. So I think just be honest about what you would do in that situation and have a reason why to explain that if they ask for you to explain. The other questions that we receive is how long do interviews typically last? What are formats? So this is a great question as well. So typically the interviews are only like 15 to 20 minutes. Typically you're going to interview with one faculty person, maybe a resident person, and then the program director. And then you may also interview with a staff person. So it varies. Usually, it can be 3 to 4 different people interviewing you. I haven't run into a lot of programs that interview you in a panel style or alongside other interviewees. It's usually one-on-one. And I can't say if there are other programs that do have different formats, but typically it's one-on-one with 3 to 4 different interviewers for about 15 to 20 minutes. So again, you can't it goes by really fast. So that's why it's really important that you prepare to have what your agenda is for your interview as well, and kind of weaving that into the conversation and what they're asking you to also answer. So these are all great questions that you all came up with. Other things I would just kind of reflect on after the interview. Some people have questions about whether they should respond back or not. Some programs will definitely tell you, oh, we don't communicate afterwards, because I know, especially in California, they kind of came up with the whole agreement that the programs won't respond afterwards unless it's a very unique question. But it's like, if you don't hear back from us telling us, oh, they're telling you that this was a great interview, thank you so much, it doesn't mean anything. Whereas other programs might like kind of reach out to you multiple times, that may also not mean anything. So don't read into whether a program responds, like sends you a thank you email or not, or how many times they contact you afterwards. That doesn't mean anything. It's just to kind of keep an open communication for you. I would say that if you want to send thank you, emails or cards, you can, but it's not necessary. I would say it's really more meaningful to have communication afterwards if you do have a specific question after leaving, right? Because after you've done a few interviews, like, oh, this program has this, I wonder if this other program had that, I didn't ask them that. That's a great time to do that. Or even keep in contact with some of the residents and say, oh, I have these follow-up questions, so that it's not necessarily directly to administrators, because the administrators are also busy trying to organize for so many other students to come and interview. So keeping all those things in mind as well, that if it's something very, minuscule that a resident can answer, that might be the better option. But otherwise, it's not necessary to kind of communicate with the programs afterwards unless you have specific questions. Other things that I've kind of thought about with interviewing is the importance of doing mock interviews. I would recommend at least doing one. If you can do two, that's even better. And if you have not done one, you can definitely reach out to your schools. I know a few students within the ABFMP have done mock interviews with some of my mentors. So definitely try to get those jitters out and get feedback on how you can improve beforehand, because it's a little, you haven't interviewed maybe since you went to med school. So, you definitely want to be kind of on your game and kind of get those direct feedback after your mock interview is even more important, even if it's for like 2 to 5 minutes to doing mock interviews as well. I would definitely do that as well. So that's another point about interviewing. And other things is just like be able to answer why family medicine, why that program perhaps is another aspect. And I would also say when you're answering family medicine and the importance of you knowing kind of somewhat what you want your practice to be or the changes that you want to make within medicine is important, because using the same line of continuity and caring for all like lifespans is kind of very generic. I mean, that's why a lot of people go into, or a lot of people can't decide on one thing, and I like everything. So like that's very common. So if you can kind of stick out and have a more unique answer by being very specific about what your goals are within family medicine, or even if you have specific interests within family medicine, like addiction medicine or OB care or women's health or adolescent medicine or sports medicine or things like that, those are going to help you stick out more than just saying, oh, family medicine is great because I like to do everything, or I would like to have continuity medicine, or I want to do preventative medicine, because those are very, typical. So that's another aspect. Other things I think to also keep in mind is if you do need to do breathers ahead of time, like do what you need to do to try to um, kind of prepare for that. But I think that's mostly everything. It really is a conversation. And it's I know it feels like a lot of weight falls on this, but they brought you there for a reason. They want you. They see something special in your application. Just keep in mind that they review hundreds of applications and they can only offer interviews to, less than a quarter of that. So keep that in mind, that you stuck out already and they do really want you. So this really is a time for you to get to know them better. They get to know you better, and you make a good decision, an informed decision about where, how you want to rank them. So, and that is also to say, well, that you may, figure out a place that you thought you really liked, it doesn't feel right, or a place that you weren't really expecting, like becomes really a place that you are surprised by. So those things are going to happen. And what I would say is it's important after your interviews to really kind of reflect on how you felt, things that you noticed. You don't necessarily have to make it a formal thing, but just take recognition of that, like, 5-10 minutes, and really like reflect on it or talk to somebody about it so that you can kind of, you know, keep a list in your mind a little bit, so that when it comes to ranking, you can take all of those things in consideration. But we'll talk about that more later on. So, some other resources, if you have additional questions, there's always the ABFMP group me if you are a member. It doesn't cost to be a member, so join that. And then there is also a group me specifically for the fourth year medical students, so that you guys have your own space to talk about how you're feeling throughout the process. The AFP has a Strolling Through the Match PDF, so you can always look at that, and it's a really good document. So if you haven't seen it, I would definitely look at that, and they'll have some example interviews and more tips on interviewing. There's also the AFP app, and they have basically kind of organization, where you can keep track of your interviews and how you might decide to rank places. I will also say this about ranking because I know some people ranked as they went on. So each time they interview, they would kind of move the programs where they felt like they would perhaps rank them. So I know some people kept like a running rank list. So by the time they got to ranking, they already had their rank list. That wasn't something I did, but I felt like because I was reflective on places, how I felt about them, what I feel like I would learn there, and the type of services and training they had, I was able to kind of keep a mental list without recognizing it. But some people really, and I think it's a really great idea, honestly, to perhaps keep a rank list as you're interviewing. And every time you interview, kind of think about where that program might fall in comparison to the other programs you already interviewed at. And there's also the National Resident Matching Program. So you already did ERAS and you should go ahead and register now. That should be open for you to register so that this is where you will actually do your rank list. So you can already be prepared for that. So that would be the next step in addition to continue to organize your interviews. And then we'll have our next session in January and we'll talk about ranking strategies. We'll also have a session on managing finances in residency and then advice for intern year. So I hope you all enjoy the holidays that are coming up. Have a great rest of the interview season. And we'll get to you all about the dates for the upcoming sessions, but keep an eye out on our next session in January on ranking. If you have any questions, you all are always free to email me. That's my personal email, ryan.walker@glfhc.org. You can also contact the Association of Black Family Medicine Physicians at contact@abfmp.org. Follow us on all our social media so that you can keep up to date on events that we're having and such. And then if you have not already joined, you should visit our website and join us so that you can stay in the loop on our GroupMe and things. And I'm wishing you all the best. I'm so happy for those of you that have heard for interviews. And if you haven't heard, just keep the faith. And it may also be beneficial to start to reach out to a few programs about where they are in their reviewing process if you haven't already heard back from some places. But you might go all the way up until, January and February for interviewing. So again, reach out if you have any questions and good luck.